sensors tend to drift over time. What that means is the baseline, the reference, the zero value becomes unstable. And typically the sensors we use today in hospitals drift over several days. Within a week, they're essentially unusable. Since this sensor is inside the heart, we need for it to stay stable for years. Using MEMS technology, microelectromechanical systems, and wafer manufacturing, we've created the world's most stable sensor. CardioMEMS is a wireless technology to treat chronic diseases, specifically heart failure. What we have done is create a little tiny implant that goes right into the heart and measures the pressures that we would measure during a cardiac catheterization. A cardiac catheterization is where we go in through the patient's leg or their arm actually into the heart and measure information by essentially putting a tube into the heart. Now that's an invasive procedure. It's got risk associated with it, so we don't want to do that very often. What CardioMEMS does is that we can get that kind of information, really precise physiologic information, every single day. By having that type of precision, the doctor and nurses can take action ahead of time. So it's a very rapid way to adjust treatment, adjust medications. They can also do other things besides medication. They can use other types of devices, a lot of new pumps that are coming out that can actually mechanically assist the heart. So they have a lot of tools in their tool chest that they can now apply in a much more efficient fashion, having this information on a daily basis. Heart failure hospitalizations, there are over 1 million of them a year, costing about $50 billion. There's 6 million patients that have heart failure. Using our device, we've reduced hospitalizations by 37%. So if we can reduce that by 20–30%, we can save $10–20 billion a year, in addition to helping the patient stay out of the hospital. One thing we heard from a lot of patients is, I never know when I'm going to get sick. It's in the middle of the night, they got to call an ambulance, go to the ER, so it's a very traumatic, stressful event. They almost have post-traumatic stress disorder because they're always on the edge. And several of them said to us that having CardioMEMS, I know that my doctor is able to watch over me, I feel much more secure, I can relax, I can go to sleep. We really have focused on the customer, which is the nurse and the doctor, and made it very easy for them to access this information. So I think this type of integration of devices and health IT represents the future.